morning, my dear students. I want to present you a new lecture about anatomy of the urinary system. Reflect please on your notes. Next question under consideration. First question, phylogenesis and ontogenesis of the organs of the urinary system. Second, anomalies associated with development. Third, the general plan of the structure of the urinary system, its functions. Next, morphofunctional characteristic of kidneys, function, structure, topography, fixing apparatus, structure features, and blood supply. Next, the structure of the nephron, the formation of the primary and final urine, ways of urine excretion, ureter, bladder, urethra. Next, age features, variants and malformation of the urinary system organs, and last, clinical methods of examination of the organ's urinary system. My dear, reflect please this information on your notes now. Well, we will begin. Embryogenesis of the kidneys. The kidney develops from the middle germ leaf or mesoderm from its segmentals left nephratomes. Development takes place in the form of the three consecutive alternating pair generations. First generation, this is pronephros. Second generation, this is mesonephros. And third generation, this is metanephros. Reflect please this information on your notes now. Next, on this picture you can see this is three stage, pronephros, mesonephros and metanephros. Once more please, pronephros, this is mesonephros, and this is metanephros stage generation of the kidney. On this view you can see general plan of the structure of the urinary system. You can see peculiarities between male and female urinary system. Значит, general peculiarities: two kidneys, two ureters, right and left, ureters dexter and ureter sinistre, urinary bladder, and uretra. You can see different parts, male and female uretra, and different lengths, male and female uretra. Reflect please on your notes the functions of the kidneys. First function, maintaining of the homeostasis, production and excretion of the urine, maintenance of the ion salt composition, maintenance of the pH, regulation of the content nitrogen containing substance, regulation of the blood pressure, synthesis and release of the renin. Next, erythropoietic function, kidney synthase erythrogenin. And next function, synthesis of the biologically active substance, for example, prostaglandins. Reflect please this information on your notes. Next, synthepia of kidneys. You can see different synthepia between right and left kidney. Write please. Right kidney has next synthepia, regio epigastrica, regio abdominalis dexter, and regio umbilicalis. Left kidney have projection on two regions, regio epigastrica, regio abdominalis sinistra. Reflect please this information on your notes please. Next, prolong this information. Reflect please it on your copybooks. Well, we will begin. You can see different between position right and left kidneys. Please pay attention. You can see very interesting neighbor organs what located near the kidneys. Skeletotopy of the kidney. Write in please in your notes this information. The right kidney is the level of the TH12L3. The left kidney is at the level of the TH11L2. You can see different position between the right and left kidneys because from the right side you can see very biggest right lobe of the liver. It doesn't mean right kidney has more lower position than left kidney. Write in please. The right kidney lies below the left. And next very important information. Last rib crosses at the border of the middle and upper third right kidney. The left kidney last rib divides in half. You can see this control moment. This is last rib or 12 rib, and different picture between right and left sides. Next, animation of the skeletotopy of the kidney. On this slide present location and anatomy of the kidneys. You can see renal artery, renal vein and ureter. Also you can see renal cortex, renal medulla, major calyces and minor calyces. This is present renal pelvis. On this slide present peculiarities external structures of the kidney. You can see two surfaces. Anterior surface more convex, opposite side posterior surface more concave. Extremitas superior, extremitas inferior. Margo medialis, margo lateralis. From this side, margo medial, margo lateral, extremitas superior, extremitas inferior, and this is anterior surface of the kidney. On this slide present peculiarities fixing apparatus of the kidney. Remember and write in the structure on your notes. First of all, this is intra-abdominal pressure. Second, tunics of kidney. Tunics of kidney present next main structures. This is renal fascia, fat capsula, fibrous capsula. And last, this is renal pedicle, renal artery, renal vein, ureter. Reflect please this information on your notes please. On this presentation, present vascular segments of the kidney. You can see apical segments, caudal segments, anterior inferior segments, anterior superior segments, and posterior segments. Reflect please this schematic picture on your notes. Reflect please this information on your notes. On this slide is present extrarenal urinary tracts. Extrarenal urinary tracts include two ureters, ureters dexter and ureter sinistra, this is pars structure, urinary bladder, and uretra. Uretra, this is unpaired structure. Reflect, please, this information on your notes. My dear, on the slide present more important information about peculiaris ureters. Reflect please this information on your notes. First of all, this is long muscular tubes transporting urine from the kidneys to urinary bladder. Begins as a continuation of the renal pelvis. Each ureter include abdominal part, pelvic part, and intramural part. Abdominal part, pelvic part, and intramural part. On this chapter of the slide present information about cause ureter through the abdomen. Reflect please this information on your notes. Next, on the slide present localization uretary constrictions. The ureter has constriction at 3 points: sites obstruction and stone impaction. Very important information, because when you can see stone disorder of this region, first of all, constriction, very dangerous place for localization. This is urinary stone. First constriction located at the ureteropelvic junction. Ureteropelvic junction. Second constriction located at the level crossing of the external common iliac artery. And third constriction located at the site of the entrance to blood. Reflect please this information on your notes. We'll begin. On the slide present arterial supply of the ureter. Ureter is supplied by the multiple arteries through its course. From next main arteries. Renal artery, these parts of the ureter, blood supply from the renal artery. These parts of the ureter, blood supply from the gonadal artery. These parts of the ureter, blood supply branch from the common iliac artery. And these parts of the ureter, blood supply through the branch which outlet from the internal iliac artery. Remember please this information and reflect it. Next, look please this image. Onto this image present X-ray examination of the calyx pelvis complex and ureters. You can see projection of the kidneys, right and left kidneys, and you can see peculatories, calyces minor, calyces major, renal pelvis, renal sinus, and peculatories anatomy structures of the ureter. And also you can see this is constrictions of the ureter. First constriction, second and third constrictions of the ureter. Urinary bladder. Urinary bladder located immediately behind the pubic symphysis. Shape and relation vary according to the amount of the urine it contains. You must remember very interesting attitudes between the urinary bladder and peritoneum, because this is unique organ. When these organs empty, these organs covered by the peritoneum only one side and have extra peritoneal position. When these organs full, three sides covered by the peritoneum, and this stage, these organs has mesoperitoneal position. Reflect please this information on your notes. Slide. On this slide present mid-sagittal incision of the abdominal and pelvic cavities. You can see difference between male and female pelvic cavities. First of all, on female present uterus. On this case you can see two excavation. Excavatio vesica uterina and excavatio recte uterina. This is very lower place of the abdominal cavity and very important place. Why? Because when your patient have immediately stage, for example, perforating ulcer, first of all, level of the liquid or level of the blood located on these places, on this excavation. Male pelvic and abdominal cavity. You can see only one excavation between rectum and urinary bladder. This excavation has specific name excavatio recto vesicalis. Also, you must remember peritoneal cavity for male it's closed, for female open through the vagina, cavity of the uterus, uterine tube. Remember please it. On this slide present peculiaris anatomy structures male urethra. Male urethra more longest than female urethra, 20 centimeters long, and have next part, prostatic part, membranous part, and penile part. Remember please and reflect name these parts on your notes. Next, on this slide present peculiaris prostatic urethra, peculiaris membranous urethra, and peculiaris spongy urethra. Reflect please this information on your notes. On this presentation, present peculiaris female urethra. Female urethra extend from the neck of the urinary bladder to open externally through the external uteral orifices, anterior to the vaginal opening. Has only urinary function. Urinary function. On this slide, present peculiaris malformation, urinary system. Very interesting picture. On this case, you can see absent one kidney. This is malformation has specific name, agenesia. On this slide, you can see very big quantity cysts from the left kidney. This is multicystic dysplasia. On this slide, you can see vesica-ureteral reflux. Vesica-ureteral reflux. On this slide, you can see hydronephrosis. On this slide, you can see megaureter. On this slide, you can see duplicated collecting system. On this slide, you can see posterior ureteral valves. On this slide, you can see ectopic kidney. On this slide, you can see non-typic form of the kidney. This is present peculiaris X-ray examination when you can see malformation of the urinary system. Different attitudes between kidney and ureters, right and left ureters, in case of the malformations. On this slide present normal kidney picture. On this slide present polycystic kidney. Polycystic kidney. Please pay attention. On the slide present peculiaris ultrasound investigation of the kidney. Took part for position of the patient and position of the ultrasound apparatus. Ultrasound investigation took part for performing measurement size of the kidney and look external and internal structures of the kidney. Look renal pelvis, look calyces minor and calyces major, and also you can use specific mode of the ultrasound investigation. This is Doppler mode ultrasound investigation, and look passage of the urine and look peculiaris blood supply of the kidney. Peculiaris blood supply of the kidney. Doppler mode ultrasound investigation took part look function of the kidney. Generally, ultrasound investigation look morphometric structures of the kidney. Doppler mode ultrasound investigation took part to perform estimation function of the kidney. Next, very interesting method of the investigation. This is dynamic kidney scintigraphy. Radiopharm preparates take and after lag of the time perform elimination. This is radiopharm preparates. Thank you for attention. My best regards. Take care of yourself.